Now let's dive deep into this big LGBTQ story for today. I'm Von Biggs, and let's queer up health. 45-7 administration cuts LGBTQ plus health research grants, jeopardizing vital progress. Researchers dedicated to improving queer health are sounding the alarm as nearly 300 grants have vanished as part of a sweeping rollback of funding by the federal government. NBC News reported the National Institutes of Health has canceled at least $125 million in grants, with researchers blindsided and fearing for their jobs. The losses hit hard in LGBTQ-focused health, especially in areas impacting gay and trans Americans. NBC News explains that many of the cancellations trace back to the 45-7 era executive orders that banned recognition of trans identities and halt DEI, diversity, equity, and inclusion initiatives. As 45-7 and Vice President Vance campaign, LGBTQ researchers are bracing for more attacks. Harvard, Columbia, and Penn have already seen research stripped. At the CDC, critical HIV surveillance programs were axed on April 1st, including specialized STI testing labs targeting diseases that disproportionately affect gay men. Even studies into cancer and heart disease were dropped if they were mentioned LGBTQ groups. Julia Marcus of Harvard Medical School said, quote, "This is what authoritarianism looks like," end quote. While the NIH's new director, Jay Bhattacharya, says he supports health for, quote, every American, end quote. His statements admit gender identity and fail to mention HIV, still a crisis in queer communities. Dr. Chris Beyrer of Duke Global Health said, this, quote, reminds me of the early days of AIDS. We cannot go back, end quote. But for many researchers, it feels like we are already there. Okay, a couple of things. Reading the story, a lot of it is attacking researchers and a lot of our universities that do research. And I find it interesting because I kind of see it on both sides. I mean, we've seen a lot, the pendulum swing go really left and just everybody losing jobs. But when you look at agencies that are getting federal grants and they're charging potentially 25% or more just for administration costs to take off the top of the money, and not really, it's how much of it is really being used in the research. There's where I start to really look at the questions and want to know what's happening. And I see that happening more and more, especially in these universities. They're taking way percentage tops off the money before they can do that. When you think of even HIV in general, you know, the government gets their cut, then it goes to the state gets their cut, it goes to the county, gets their cut, before it gets to the people that actually get to use the funds for HIV. I've seen it with, obviously, I went to the HIV Cure Academy not too long ago down in Philadelphia, and it was like, while we were there, they got notified that the funding was cut.
Wow.
And I look at that and I go, but they're also private funded as well. So it's not, well, yes, that's a lot of money that's being lost. A lot of these universities have access to $1 billion of endowment that they could probably pull upon to use. But I did think it was interesting that about 2 hours ago, or 3 hours ago, I guess it was, that Harvard just came out and basically said...
Came out as gay?
No, they came out...
We wish.
Right?
Sorry.
No, they came out and basically said, no, we're not going to stand for this. We are not going to back down and not say DEI or not say LGBTQ. So... And think about it, they're one of the oldest institutions in our country.
That's
and
a blessing.
If they can stand up, the rest of these larger universities can do the same.
Hopefully they can follow suit, but it really does still saddens us. I mean, straight people get HIV and AIDS too.
Yes.
That's the part in the comments when they were saying, you know, I mean, over 51% are, you know, women living with HIV worldwide.
Exactly.
So it's kind of like, wait a minute, it's not... Everyone wants to point it towards gay. We see it all the time. They want to point HIV to the LGBTQ community exclusively. Yes, we are proportionally affected in different areas of the country. But at the same time, it doesn't have a discrimination. The disease
no, it really doesn't.
It doesn't discriminate.
So, and your story was mainly universities, right? And you know, because I've also heard of a lot of other cuts everywhere. You know, grants being cut for our nonprofits here locally. That now they're trying to stretch a dollar as far as it will stretch, because they were expecting a certain amount of money for 2025, and that was cut abruptly at the beginning of the year. So we will see this kind of effect even locally as to what it will affect. But I mean, you know, cancer. I mean, we're so close to certain cures, right? That it's like, you know, we've all been affected by cancer at this table. 2 people at this table had cancer.
Yes.
Okay. Like,
Yes.
so it's a lot out of 5.
Right.
You know, and we're going to stop that kind of testing and that kind of investigative research because it might help some gays too. Like,
yeah. This is another, like, we're going back on science. Like, I don't know why we're doing that, you know. And another thing, this is the importance of voting. This is the importance of voter registration. This is the importance of getting out and actually, you know, people, you know, the gays on Grindr, you know, they think that, hey, you know, voting doesn't affect me. You know, voter registration doesn't. Well, this is the direct impact, right? Do you get tested? You get tested all the time, right? And we're having a lot of gays, right? They don't want to talk about politics. They don't want to talk about the current administration. They want to be on Grindr. They want to have fun. But this is the consequence of that. This is the consequence. We have stuff like this where we're losing grant funding. We're losing HIV. I mean, these nonprofits here in Wilton, Fort Lauderdale, even in where I'm from, where Miami, Hialeah, right? You know, this is the impact of not registering to vote. This is the impact of not having those conversations about politics, about not wanting to have those uncomfortable conversations about not registering to vote.
yeah. Well, that is the big LGBTQ story for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.